Here's our next video in this series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We're now in post-op week 15 of Maddie's progression. And at this time, remember, we want to work on running, sprinting, pivoting, cutting, jumping, and her functional activities. Now that she's not traveling anymore, hopefully we can get her into a more regular schedule in the clinic. We continue with her warm-ups and mix it up with a little bit of jump rope, doing both legs here. We'll also have her do some single leg jump rope. You can see on her uninvolved right leg here, and then shortly you'll see her on her left, which she actually does quite well on, considering she's never done this activity before. We also bring in some things they'll do in soccer, some dynamic swing throughs, with the addition of an AirX pad, which is a movable surface underneath the standing leg to displace her center of gravity. Now the side-to-side swings that you see here, she did okay on her right leg, but she really struggled standing on her left leg, showing that there was still some deficits when her center of gravity was displaced in the lateral direction. We continue to work on our strength base with all your traditional lower body strengthening equipment, leg press, etc. But we also want to bring in the dynamic components, such as the single leg lunges that you see here. Again, we do it onto a dynamic surface, so she has to adjust to those changes. And you can see that her body position is much better, as is her hip flexor flexibility. We did some single leg rows, as you see here. We also would incorporate some upper body strengthening, like the curl and press. And if we put them on the Dynadisc, the movement of the upper body actually displaces her center of gravity and also makes this a balance activity, keeping her knees bent. You get a good co-contraction between the quads and the hamstrings. We don't forget to progress her functional activities. Here you see her start to do some jumps, working on a slow controlled descent, an explosive jump, and then controlling the eccentric loading of the quads when she lands. Want to make sure she has good alignment and good knee control, as she shows here. We get her back onto the turf. You see her doing some 20-yard shuttle. Much better acceleration than was seen a couple weeks ago, getting much more comfortable with her cutting. And when we look at the cone drill here, called the W drill, it's a 45-degree angle that she's working on accelerating and going from a forward sprint to a back pedal. We'll give her a brief rest in between, and she'll go back the opposite direction. Now, as we've seen with most of our functional drills that we do, you can do it as an activity, but then you can also do it for a specific length of time to work on it as a conditioning activity and bring in a little bit more of her anaerobic system. Now, in summary, she's continuing to do well with her good strength base, knee control, has much improved confidence with cutting, and shows good acceleration. As we look ahead to phase 4, we want to get her out onto the field, work on some shooting drills, work her into a controlled practice setting, scrimmaging, and then finally when she's cleared by the doctor to return to play. Thank you.